I'm going to pause just for a second because I want to make sure that everybody's running real time and that no one's computers are lagging behind. So is everybody now at full note composure under the vitals section?
Yes.
Very good. Sometimes it depends on internet speed going through WebEx. It may slow everybody down. So if at some point you guys notice that I'm talking about a screen that you don't yet see, somebody just yell at me to slow it down just a little bit because it runs very quickly on my end because I'm running the MyWay system. It's very quick. But going through the internet to all of you guys, sometimes it slows it down just a tad. On the vitals section, we put in as many vitals as we normally get. So if you only get height, weight, that's all we have to put in. So we'll go ahead and just add in the patient's weight, height. Maybe we get respiration, so we'll just put in respirations, heart rate, and then maybe blood pressure. We can have certain items default on this screen, such as location. If you always get their blood pressure radially, we can build it where it automatically defaults radially. Once you're finished, the nurse would simply click Update. If they needed to make a change, they could simply come in, change one of their vitals, and then update it again, so it's easy to change. Once you update it, it gives you another line for new in case you had to come back maybe because maybe their blood pressure was a little high and you wanted to wait till after the initial part of the exam, take it again in 10 minutes or so. You can record multiple vital signs. Also great for those patients that are coming in for procedures and you want to record multiple vital signs on a visit. Under Chief Complaint, the system will come pre-built with 18 different systems. There's 14 true body systems, but we then add health maintenance as one. There's one called Other, and then we break it apart a couple of systems. What we've done for the case of urology is removed all those systems except for the two that we think they are the three that you'll be working with most commonly, which is genitourinary, constitutional, and Other. But when you actually get the program, you get all of the systems, just in case you ever add another specialty to your practice. So there's no additional charge to get the entire group of systems. You'll see them all. But we've easily just taken them out so that we could only look at the ones that matter. If it is a complaint, you'll notice that we have most frequently used. This will build itself as you start to use the product. So when you first open the box, most frequently used would be blank. And that's because it doesn't know what you like to use yet. So once you start to diagnose and mark in some chief complaints, it'll start to remember what you record. So here it says that the thing that I use most often is acute renal failure. For this particular patient, we said that we were going to talk about some painful urination. So here we have dysuria. We could put in more than one. So if the patient said that they have increase in frequency, we can choose both. And this would just simply be point and click, easy chief complaints. If we had any information we wanted to add, we could always come over here to this notes section, and that's free text. As well as we have a section up here at the top that you're going to notice on every tab. I want to go ahead and talk about these notes sections so you can see how we can input information here. First way is, of course, just to type it. The next thing we can do is use Dragon Naturally Speaking. So it's just a voice recognition software. You simply would click in that box and start talking in your microphone, and it would record what you're saying here. We also, if you have a pen tablet like I do, you can write it and then just click Convert, and it'll convert what you've just handwritten. And then we also have the ability to click on this hyperlink, and a hyperlink is simply just the words in blue, which will open up another screen. And we could add brand new ones here. So we could add a list of ones that we use commonly. So if I just wanted to add one called pain, here at the top, if I didn't want to type the word pain every time, I could simply just go and click on pain. It could put in a word or an entire paragraph. So we can do some quick notes. You're going to notice that in every single tab going across the top, it works the same way. Most people don't use it in chief complaint because it's easy point and click. Where I see people using this section is for physical exam and review of systems. If they have Dragon, they use it a lot. So instead of having to point and click their physical exam, they simply just click in the box and start talking just like you currently do through your dictation software. That's what you use. So we chose our two complaints, and then we're going to move to HPI. Now we're going to notice that in these two symptoms that the patient had, you're going to have a list of questions below. So it would ask for dysuria. It's going to say quality, onset, significant medical condition. So you have all of these categories. These questions are relating back to dysuria. So if I have under urinary frequency, my questions are going to change a little bit, and so would my responses be. So if I start here on dysuria, under quality, we can say what kind of pain it is. So it's going to be a burning pain. And we could choose more than one. So a sharp burning pain. When did it begin? So you could say it began 2 days ago. So if I have an underscore here, I can simply click on that option and then type a 2, and it would put in 2 days ago up here at the top. I can skip questions. So if I don't want to answer onset and resolution, maybe I want to go to significant medical conditions and note that this patient also has diabetes. I could put that in. Any alleviating factors, I could click on alleviating factors and say if anything makes it better. Once I'm finished doing in some history of present illness for dysuria, I can go to urinary frequency, and we could put that in as well. So urinary frequency, it's getting worse. It also began 2 days ago. What you're going to see is at the very bottom of your screen, you're going to see where it says 4 points charted. Each section has a total number of points. There's a maximum number of points that you can get for history of present illness. The maximum number of points you can get is 4. We've put in the coder based on 2007 E&M guidelines. That tells me I can only do 4 points for HPI. I can put in more information to further my documentation, but at this point I've obtained the maximum number of points I can for the HPI section. If for some reason I want to add something to any of these columns, there's no need to go out of our software, go log into a template builder and add it. We simply click on the blue hyperlink and click the new button, and you can easily add items to this list. So out of the box, you're seeing exactly what it comes with, but this may not be the same terminology that you would use, or maybe you want to add another question. Same thing, you can click on that blue hyperlink and go under the questions and simply click new and then add some answers. We can also remove items, so if it's something that you don't want to see, we can hide it. We don't actually have to delete it. So if for some reason I wanted to get rid of all of them but worsening, and I said close, and I said yes, I could save it, and you see that under quality, all of them have disappeared. I haven't actually deleted them. I've just hidden them from my view. So if I want to go back, I can just click Include Hidden Items in List and uncheck them all, and they're all right back where we started. So very easy to manipulate all of these columns. During your implementation consultant will walk through, of course, how to do all of this, as well as help you in building them. You'll have lots of training on how to make that happen, so that the day one when you start using it in a live environment, you have everything that you're used to seeing or that you want. After the nurse does the history of present illness, we can move to the history section. This history tab will look like it did during the last patient's visit. So, of course, the first visit, it would be blank. There would be no medical history, surgical, family, social, med, or drug history. After you see the patient the first time, it just remembers and copies that HX tab forward because there's no need to re-enter surgical, family, social. So all we do is just verify that everything is here and that nothing is missing. So under medical history, the patient, we've seen them before for urethritis. If we want to add another disease, so they told me they've recently been diagnosed with diabetes, I could go ahead and just click and add diabetes to his list. Under surgical history, there's no previous surgeries. Under family history, he said that his mom nor his father have any medical problems. Under social history, we put a marital status, that they are sexually active, and tobacco history, that they've never smoked or chewed. But if we wanted to add alcohol history, we simply could click on the question and then the answer on the right-hand side. So we could say that the patient currently drinks alcohol, has been drinking alcohol for 15 years, and drinks 1 to 4 drinks per week. Under medication history, we have 2 options to get their medication in here. First option is to enter it ourselves. So the nurse goes over their medication list with them. The patient tells me that they are on glucophage. So I can just type in a little bit of it or the entire word, hit the magnifying glass, and I see all of my strengths of glucophage appear. I could just click on one, and then if I know how often they're taking it, I could answer yes to the SIG, and I could go ahead and put in how much they're taking. So they're taking 1 tablet PO 2 times a day, every day, and then say OK. So I've just put in their SIG. That's way one, to get everything in by manually keying it. The other way is the front desk, because MyWay has both practice management and EHR in the same system. So you can easily add demographics, file your insurance, do everything straight out of MyWay. So the front desk has already taken this patient's insurance. And we see up at the top they have United Healthcare. It's at the very, very top of your screen. So we've put in their insurance information. The system will go out to their insurance company electronically and find out what medications they're on. That's called their retrieved history. So that instead of having to key them in, the only ones we would have to key in are the ones that would be missing from that list, which would be over-the-counters, any vitamins or supplements that they're taking, as well as any medications maybe they paid cash for and they didn't use their insurance card. It's a very accurate way to get a list of medications. You don't want to query the pharmacy, because what if I went to CVS today and Walgreens yesterday? So we don't query the pharmacy that they tell us. We query their actual insurance company. It's a more accurate list. So we could get the retrieved history and then simply add the ones to that list that they're taking. If there's been a medication that's been discontinued, you'll see it in italics. So it stays on our list. It just appears in italics. It also, if you've given someone a antibiotic, and that particular antibiotic, so you can see that this one, we gave them amoxicillin, that there's a stop date of 4/18. So at 4/18 on 4/19, this would actually discontinue itself and turn it in italics. So you don't have to remember when you're coming in to do their medication history to go ahead and discontinue anything that was for a limited amount of time, not a maintenance med. Under drug allergies, simply just click on the allergy. So if we said that our patient was allergic to sulfa, I could go ahead and click on sulfa, and then on the right-hand side I could choose what reaction they have if they take sulfa. Once again, we can add new allergies by clicking on the blue hyperlink. We can add reactions by clicking on the blue hyperlink as well. So every tab works exactly the same. Click the hyperlink to add new ones. Under Review of Systems, I've seen offices do this multiple different ways. Some of them have a piece of paper that the patient fills out in the waiting room for their review of systems. Other providers will have the nurse or the actual provider go over it with them, and they'll just ask them a series of questions. You know, have you had any recent fever, chills, weight loss, weight gain, night sweats? So you just ask a list of questions. Most of the time, the patient denies all of those. Now, if you don't do a review of systems, you simply can skip that tab. You by no means have to go in order of these tabs or hit each and every one of them. But under Review of Systems, we can build something called your group norm. So I have a list of questions that Rebecca likes to ask. So if I check this check mark, it puts in only the ones that I ask. So we can see that by the no column. We see that weakness is in the no column, night sweats is in the no column. However, anorexia is in the NA column. That means not addressed or not asked. So we wanted to keep the system here because maybe for one particular patient based on their chief complaint, I may ask that, but it's not in my routine list. So I've just charted an entire negative review of systems by clicking one checkbox. And then all I do is document the exceptions. So this patient did complain of painful urination, so I could go ahead and just change one. Much quicker than going no, 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 yes. So we just check the box. That all brings in my negatives, and then we just choose yes. Same thing as before. Your implementation consultant will go over with you how to build this. It's very easy. You do it all from the hyperlinks on this screen, so you can easily change it on the fly if we needed to. After review of systems, most of the time the nurses are finished. So the nurse would then save the note, And they could have done, more of the note for you. They could have done less of the note for you, but we'll just go ahead and say that they save it. And then the nurse simply X's out of the note. And they changed Dwight Douglas from checked in to maybe putting him in exam room. And so we'll put him in exam room 1. So the nurse would be finished, and they would move on to the next patient. What the provider will notice is that Dwight Douglas will appear on your incomplete notes section. So you know that he's ready, and it's in order of how the patients are, they're being finished. So the nurse walks out of the room. We see that was at 10:20. The next room would be underneath Dwight Douglas. So, the top one is the one to see next. And we see Dwight, and we can look over on our calendar and see that he's actually in exam room 1. To start your portion of the exam, you simply click on the date, and it'll open that note up right where the nurse left off. So we'll start in physical exam. We can go back if we wanted to chief complaint. If you had noted another chief complaint, as we all know, they get into the room, you get in the room with the patient, and they start listing all these other things that they have. So you could go in and add maybe penile pain and discharge. They didn't tell the nurse that. So you can easily add and take items away. A lot of providers didn't want their ancillary personnel or their nurses to come in and get too much information simply because it may change when they walk in the room, and they didn't want to take in their paper world and scratch out what the nurse had written. So it kind of made your charts a little sloppy. Here, it doesn't really matter. You can easily come in, make changes. There's nothing that's going to be done to your note by doing that. There's nothing that's going to be written like an addendum or let anybody know that you made any of those changes. So generally my providers kind of change their thinking when they go to the electronic, and they let their nurses do a little bit more of the exam than what they were used to doing. Once they get to the physical exam part, it works the same way as review of systems. You generally have a physical exam that you use, like your normals, and then we just chart the exceptions. So if I click my checkbox, it's gone in and put well-nourished, well-developed, and no acute distress. Under eyes, it says benign arterials, benign arterial venous crossing, benign fundi, sharp optic disc. And I know it said all those things because they're all in blue. Once again, your implementation consultant, if you don't say anything about the eyes, you don't note anything in your exam, we can easily take all of those group norms out. We can leave the eyes, we just won't have it automatically selected when you check the box. So then we just examine the one section that would be different. Now, based on the sex of my patient or their gender, below we will see those particular body parts. So if this was a female patient, we're not going to see scrotum, testes, and penis, prostate. It's going to be a whole different list. So it's based on the gender. So we can examine those particular areas. Anything that was noted, so if they said that they did have any discharge, we could document that. And we simply just, if they said, if we noticed any lesions, we could remove no lesions. And then we could go in and mark what we saw, that there was a mass. Once again, it comes with all these systems, with all these findings and all these descriptions. If we wanted to make any changes, we can simply click on the blue hyperlink and make changes to that column. After we're finished, we get all the way through our exam. We're going to stop at our diagnosis. We decided that this patient diagnosed with urethritis. We go ahead and select our diagnosis. Multiple ways to do that. We could have gone and looked at Dwight Douglas's list. So all of his previous diagnoses, and his diagnosis would have been here. We can look at our frequently used, which once again is building based on what you select. We have our diagnosis codes, which maybe came from an encounter form or an old fee ticket that you were used to using. And we could build multiple different categories. We could put in just male diagnoses, female diagnoses. So we could have added any columns or categories that we wanted to and add diagnoses to that column so that it's easy to find. You also have the ability to come up here to the search button. You can search by diagnosis code, so ICD-9 code, or description. So lots of ways to find the diagnoses from the screen. We try to give you fast, easy ways to do it. Once I choose my diagnosis, if I have seen a patient for this particular problem before, MyWay has remembered what you like to do. So it remembered what your prescription was, what your general services performed in the office, what do you like to order, and what is your plan. And I know that it's remembered it because as soon as I choose urethritis, right underneath frequently used, I see an asterisk with that diagnosis, which tells me it's got something memorized. I can go with what it offers here. I could simply click. So I could say, you know what, I'm going to give them amoxicillin. If I choose amoxicillin, remember my patient was already on amoxicillin, so it warns me there's a duplication in therapy. I could say continue. So I'm going to go ahead and refill it. Under services performed, I want to do a urinalysis, a CBC. I could choose my office visit here, or I could let the system decide what level of visit it's going to be. We'll go ahead and choose 99213. If we don't do CBCs in our office, under services ordered, we could click CBC, and that would be done, of course, at LabCorp Quest or whatever referring lab you use. And then we want the patient to return in 2 weeks. So that's commonly what I do for a urethritis patient. I can choose it from here, like I said. And then if I go to RX, just for the heck of it, I see that amoxicillin's already here. I see that my service is performed. I see my urinalysis and my office visit. I see under services ordered my CBC. And I see in my plan I wanted them to come back in 2 weeks. So there's really no need to finish those tabs. So a lot of times our doctors, when they walk in the room, they just do the physical exam and the diagnosis tab. They don't have to go to any of the other ones. If you have any patient instructions, you could always click on notes. Once again, if you said that maybe you don't want them to have any sexual contact for 2 weeks, that was one that I added in here for quick use. I could simply click it, or like we said, type it, use your pen tablet, or dictate it in. Same way with visit notes. You can create quick visit notes by simply clicking that and then adding a visit note. Visit notes generally tend to be reviewed specific labs with patient, reviewed any results from previous exams. Maybe they came in with visit notes from their referring doctor. Maybe you put in our reviewed notes from Dr. Ennis. Internal notes will be things that will not appear on your chart note, but maybe just notes to yourself that you want to go back and reference later. Once I'm finished with my exam, just to kind of give you an idea of what it looks like, we can click this little print preview. And it'll show me what my exam looks like. If I were to print it out, it's going to be what is saved in the system. And a lot of times, providers will just take a quick look at it and make sure that it's what they're looking for. You'll see your chief complaint in HPI, instead of just pointing and clicking, it actually turned it into a paragraph format. So he presented with dysuria described as burning and sharp. Symptoms started 2 days ago. Pertinent medical conditions include diabetes. In addition, he presented with urinary frequencies described as worsening, started 2 days ago. Patient also presented with penile pain and discharge. Any of their current medications, the history that you reviewed, your review of systems, the vital signs, and then your physical exam, your diagnosis, what you wrote them for a prescription today, services performed, services ordered plan, and patient instructions. It would have your electronic signature at the bottom once you've completed the note. We could print this out if we wanted to, or simply close it. We're right back where we started. And when we're happy with our note, we can go ahead and just click Close Note, and we can change this from incomplete to complete and say OK. It then will send my prescription either electronically if I've chosen a pharmacy, or in this case I didn't choose a pharmacy when I wrote the prescription, so it's going to tell me it's ready to print. We simply click OK, and then we'll be right back to our main screen. What we'll notice in a second is Dwight Douglas will disappear from our incomplete notes section. We see that he's also gone to ready to discharge. So the front desk knows that Dwight's on his way out. They can click on this door icon. They could post the payment. So if they wanted to post the copay at checkout versus check-in, they could do that. They could also print a back to work or back to school form by clicking on that print selected forms. We could print patient plan, prescriptions, again, if we needed to, their visit receipt, remind the patient what their instructions were, and then we see when you wanted them to follow up. The front desk could then click on that 2 weeks icon, and it would jump them 2 weeks out on their scheduler to go ahead and schedule that appointment. Once they're finished, they'll click OK, and you'll notice that it changed from to discharge. It says checked in at 10:05, discharged at 10:29. So that is a patient visit comes in for new complaint. Now let's go to one that's kind of quick. For James, he's coming in simply for a procedure. We're going to click on Open and Create a Note. Open me straight into their full note composer. I could put in the vitals if you get their vitals prior to the procedure. I don't have a chief complaint in HPI. I don't need to really worry about history, view of systems, physical exam. I can come straight to diagnosis. I could diagnose them with, of course, like elective sterilization, and then go to services performed. This is the main tab that you'll use for procedures. And your implementation consultant will help you build procedure notes based on what you currently use in your practice. So if we said we wanted to do a procedure of a vasectomy, I can go ahead and click that. And we notice to the left of my CPT code, I have an icon. If I click on that icon, it's going to bring up my procedure note. At the bottom, you'll see the resulting note. So everything in this note is the same for every single patient. The procedure is performed the same exact way, except for maybe at the bottom where it says complications, there were no complications noted. That comes in as default text, but we could change that. So if there were complications noted, we could type in, complications include, and we could actually type in whatever their complications were, and we see that changes it in the note. This is simply one for demo purposes. This is not exactly what you would have to use, and you could choose as many variables as you wanted. So if there may be some variables within the procedure note, we've just added only one variable. So you simply fill in the variables, and then it changes the note at the bottom. Once you're finished, you click OK. And then if we go and print our note, we notice that it's a little bit different. It doesn't have all of those tabs. It just simply puts in my entire procedure note. So very quick. I have a lot of my providers that are pain management or have their own ambulatory surgery centers or procedure rooms. They do all of their procedures through MyWay. It's very easy to get the information that they need. You could print it or just close it. Once again, you would complete your note. And it just popped up telling me I didn't choose an E&M code, and that was because I used a procedure code. Last type of visit is for a patient coming in for incontinence. It's just a follow-up visit. So if I click to start her note, maybe I don't want to go through the whole process again. I just want to copy her last note forward and make any changes. So we have the ability to come up to this follow-up visit, and we see that she was here on 4/22 of 2008 for urinary incontinence. She's following up on that visit. We can click urinary incontinence, and on the right-hand side, we see every piece of the exam. If she says everything is getting better, we can click the arrow pointing up, and it would put all of those checkboxes in that column. If she said everything is worsening, so the whole incontinence is becoming worse, we could choose worsening. If she says that there's no change and it's completely the same, we can click the arrow pointing to the right. We can click it and make it effective for each column, or we could go through each question and ask. Under the pill, if I click on that pill, it just means that everything is resolved. So now, by simply clicking one button, she told me that everything's getting worse. I simply can click over back to my note, and I see that my entire chart note has been written, and it's been documented out to the side that it's worsened. So with one click, I've documented my entire chart note. I could then just go back and make the changes to the positive findings. If there's anything that is better or that we didn't go over with the patient, we could make our change. But it's just a way to copy an entire note forward. Same thing, we just close our note, mark it as complete. A couple other things just to talk about quickly. We have the ability, of course, to do results, and we can even graph those results if we wanted to. So let's go back to James for just a second. When we were in James's note, if James had some maybe labs that we wanted to look at, on our screen we have the ability to click on patient results. This will show me any results that come through an interface or that you document inside your practice. And I see on the left-hand side I've got a pathology result and I've got my PSA. So if I click PSA, I see my PSA over time here at the bottom. So that's every time it's come back from the lab or every time I've manually entered it. I have a graphing feature. If I wanted to, I could actually click graph, and I could graph their PSA. You can graph any vitals or results. You can also print those graphs if we wanted to. To enter a PSA result, if I had one and I didn't have an interface, it's really simple. We would just click Enter Lab Result, We could just click PSA here at the top. It's a lab result, and then we simply put in the value. So if we had a brand new one, we could say that this particular one was 3.8. We could send it to the provider for review. So I could send this to Dr. Plummer, put in the date that he ordered it, the date that we have a result, and click OK. So we've easily added another one. We see that one here. When the provider reviews results, we're going to kind of go back to our screen here. It appears in their message center, so if the provider has any labs to review, whether they come back because we've entered them manually or because we've gotten them back from an interface, you would simply click on labs, click on the date for the one you want to open. It'll show you that patient's lab, so you'll see PSA was 3.8. Instead of signing off on it, you simply just click approve, and it'll put your name and the date that you approved it. If you wanted to maybe forward to the nurse, you could even click the envelope pointing to the right and send this to the nurse or a specific user, and then you could just say, call patient with results. Or you could change their medication, anything that you normally put on a message, and say OK. Anytime you add anything to a patient, a chart note, a lab, a scanned image, it all goes into what we call review pass notes. Review pass notes is simply go get me James' citizens chart. So if I wanted to go back, and maybe James wasn't on my calendar today, and I wanted to look at some items for James, I could just pull him up. This is his whole chart. I can see any visit notes, so I could click on this. I could see all the visit notes for every date of service. If I had any attachments, I could click on the attachments. I would see any attachments made. And I also have all my lab results in here. Could see each one that they had approved or resulted, as well as the ability to see them side by just clicking patient results, and it takes me right back to that other screen. So all of these icons, there's 7 icons that you end up learning in MyWay. Those icons are available to you from the Full Note Composer, from Review Pass Notes, from your main screen. So it seems like there's a lot of different fields, but it's really the same 7 repeated over and over and over. They're just available in every screen for ease of use. All right, that's a whole lot of information in a little bit of time, but I just wanted to make sure that we covered all the key features of our product. So do we have any questions?
So if all we're interested in is just the where ours use the handheld and dictate, and we're not interested in the billing part or anything like that, we just want you have that?
Right. Yep, we sure do. What we like to do is still schedule the appointment. If you don't have the appointment, if you don't want to use it as a scheduler at all, you can always come right up here to find patient. You have to enter the patient's name. Right. So it's just easier to schedule them, but you do have to have a name. You'd have to have that in any system. So you would just create only the name, and you would just go to New Patient Visit Note and start their visit note from there.
Okay.
But it's much easier just to add them to the scheduler because it's very quick to do so. And you simply would just create the note and use those little top parts in the dictation and just dictate. So, yeah, we definitely have providers use it just for practice management, just for EHR, and then most of ours, of course, use it for both.
Okay. And when you say that you can dictate into this, it will remember and set up the way they automatically, have their notes set up?
Right. If you use Dragon, naturally speaking, Dragon, we don't support Dragon. Dragon just works with our product.
Okay.
So we don't sell Dragon, but that's something that a lot of our providers use and they like. So it's just a software. You would simply use Dragon. Dragon, it just allows you to have your mouse and a microphone. So you would just click in that box and start talking.
Oh, okay.
And so you're basically needing to train Dragon, not MyWay.
Okay.
I have 2 questions.
Sure.
I sent you just one on the Dragon. You said you don't support it. So if we have a problem with Dragon, will Dragon?
Yeah, you would go through your vendor with Dragon. And what we mean by that is it's just like, for example, you have a keyboard, a mouse. Those things we don't support. If you call me and say my mouse isn't working, then that's not something that Allscripts sold you, so we wouldn't support it. Okay. So it's the same way with Dragon. Dragon's just another piece of software. You can't call us that Microsoft Word doesn't work. Okay. So they do support their own product.
Okay.
But if you said, hey, it's not working in MyWay, then that's something that we would support.
Okay. On the where you have the patients, for example, and you have Dwight, and then you have the what are those two dates? You've got 10/21/1980, then you have 2001.
That's actually their number, their chart number.
Okay. And so then down below that with James Citizens, he doesn't have his chart number.
Correct. He doesn't have a chart number. And these chart numbers we put in based on maybe what your old system. So some people have like old numbers that they use. So if you don't have an old number, we can have the system automatically assign it. And the next number, the 661, is actually their phone number, which is continued at the bottom.
Okay. Does the system make any noise, for example, when you go from discharge to in the exam room, or they simply have to notice the change on the screen?
No, there's no noise, but it actually flickers, and you'll kind of see it, and it's refreshing itself.
Okay.
So it'll kind of blink on the screen. We can make those, like ready to discharge, we can make those things different colors. So we could make it like a bright red if you needed to. So all of those things are customizable to change the colors, but not to make any noise.
And then on the message center, those messages are only mine, or as an administrator, could I see other people's messages?
As an administrator, you can see everybody's messages.
Okay.
This is currently just set up for doctors, but you could set your message center to show me every single person in the office, and we could even have a different tab. So you would say, under phone messages, you could have one that says everyone's messages and see.
Oh, and so you could save Nurse Nancy's messages.
Yes, you sure could.
Okay.
Keep track and make sure as an admin that everybody's taking care of the things they need to before they leave. We also have instant message within the system here, so I could click instant message and see everyone who's logged into the system and send them a message. I see my offices use instant messages for things such as telephone calls so that they're not knocking on every door trying to find out what room the nurse is in or what room the provider's in. They simply would just send an instant message. You have a phone call line 2, and that person can simply respond back, take a message. Okay. Or tell them to hold on one moment and I'll be finished. Or you've just spent 30 minutes in the room with that patient. We're behind, you need to get out. There's kind of ways to communicate back and forth.
And as a demonstrator of the product, when we make these changes, for example, if you remove a category or hide a category, when you go back to demonstrate the next time, that will remain hidden?
Correct.
Okay.
That's why I always go back and show you how to get it right back.
Okay.
So I don't mess up the next person using the software to demo.
Okay.
Good questions.
Okay. I have a 77-year-old down to a 45-year-old. The 45-year-old is the only one that really wants to do this. So if I have it in the room and they dictate in this, I can still use partly my old way, print out the note, it's done, but it's still within the system that the 45-year-old can look at the other doctor's note.
Correct.
Okay. I'm just trying to think
of
everything.
At the end of their visit, they could just automatically print their visit note, and you can file it away.
Okay. If it's not printed, can it just be saved?
Oh, yeah. It'll always be saved. And it's
putting it more back on us to print and all that?
Definitely.
Okay. All right.
And then we also, just so everyone knows, we didn't discuss it, but there's ways you scan old patient records into the system. So you're going 100% with the HR, you just scan your records in. Very easy to do so, and just file them into the correct patient chart. And
can old notes be put on a disc and saved? If say in 5 years you want to, do away with some of those notes. It's like I have two that do not want to do this, and I still have charts. Okay.
Yeah, we can even import, so anyone looking that, had a previous EHR, or they may get notes from another provider on a disk or in a certain file format, we can always import those in as well.
Okay.
You can always export or import in multiple file formats, like PDFs, which most systems read, or regular documents.
Okay.
Any other questions?
On the hookups with the labs, how often do they come back? The results?
They run the query every minute. So every 60 seconds, there's a job that runs in the background to check with the interface labs. Okay. Likewise, it sends out the same way. Any other questions?
Not that I can think of.
And what are those codes on the top of the message center? U, AL, RL? What are those different?
Urgent, abnormal lab. The middle one's an R and for routine, and then the last one's an L for low priority. So you could easily just look and say, okay, there's labs, there's one urgent I need to respond to. That way, if you, at the end of the day, if they're all routine, then maybe you don't stop whatever you're doing as the provider and go back to that lab. But if you see an abnormal lab pop up, then you want to go ahead and respond. And that's also refreshing every minute. So you get them back from the lab every minute, and it shows up on your screen. So it's pretty much real time.
Health maintenance alerts, what would that be?
Health maintenance alerts, when you're in a specific patient chart, there's rules that you can build in the system, such as I want to get a PSA for all of my male patients over 50 every year.
Okay.
And so you build those rules, and on the right-hand side, it'll turn red if something's due. So I see that this particular patient's due for their PSA. Their due date was 7/23 of 2009. When I'm seeing this patient, I could action my rule and add it to my services ordered, so I want to go ahead and add that to my visit today. And now it just takes me off of that list.
Okay, so that...
Now my HM rules, instead of being red, now are back to my routine, my normal color, which tells me there's nothing that's due. So there's rules that you build in the system, and you can have those rules even send messages to certain users. So maybe if a patient's PSA is due, you send that maybe not to the provider, but maybe to someone at the front desk so that they can call the patient, remind them, or send them a reminder card that they're due for it.
Okay, so, great. So then that message center tells us that of our patients, there are 62 that are past their health maintenance?
Exactly.
And then if we click
you've
on that...
got 65, and so I could click on those, and you could run a report. 62, you're right, one up. So under health maintenance, if I click it, these are all the things that are due. So on 416, it tells me that the complete foot exam is due on Dwight Douglas. If I call him, I could just document on this note, patient called, and then click complete, and now that patient's gone off my list. I go to the next one. Creatinine is due on Dwight Douglas, so I could go ahead and do that. I also, instead of looking at all my messages, I could simply run a report for my health maintenance rules and send out cards. So I could choose to have them send me a message, or I could have it choose to print a report. Either way.
Since we've gone electronic, does this have the ability to send out email? Do we have that in this, or no?
We have through a patient portal, and so the email is definitely coming. Patient portal is something that we need for meaningful use,
right.
And so that just allows patients to log into the system, and then you can transmit information back and forth because they've keyed in their email address.
Right.
So it actually goes to the portal.
Now, this screen that you're working from with Dr. Plummer, again, as a displayer of the system, is these 62 health maintenance alerts, is this something you put in personally, or does this come with the system like that?
Well, if you are going to be doing if you're a reseller and going to be doing demos,
right.
What you get is what we call a brick. The brick is just all of these patients, all of these doctors, so that you can demo. Now, if you have any particular questions about what the brick entails, I can definitely go over that with you on the side.
You all are getting into things I'm not interested in. Can I go ahead and get that number to call?
Sure thing.
Okay.
I'm just going to pull it up on
Okay, thank you.
No problem. So if you're not currently in contact with an Allscripts account executive or partner,
no,
you can go ahead and dial this number.
All righty.
And so what we have, just so everybody knows, the way that we sell MyWay is we have resellers in your area. And so when you call that number, we get you in touch. And there's a lot of times multiple resellers. So So we will get you in touch with someone that can come in, maybe do a one-on-one demo with you.
Okay.
You also, if you have any, need to do a one-on-one, when you let them know, they can also schedule it with us, and we can do it via a webinar.
Okay.
So some resellers demo the product themselves. Other ones we still demo for them.
All righty.
But you would, for support purposes, you would reach out to Allscripts.
Okay. All righty. All right. Well, you've addressed a lot of my questions, and I appreciate it very much, and you all have a nice day.
You too. Take care. Thanks.
Thank you. Bye-bye.
Bye-bye. Any other questions? All right. Well, if there's nothing else, everyone enjoy your Friday. Thanks for your attention.
Before you leave, you said we might talk on the side. How would I do that with you?
You can go ahead and send me an email if you want to.
Okay.
We can schedule a time.
Thank you.
You're very, very welcome. And my email address will be on the invite.
All right. Thank you.
You're very welcome.
Bye-bye.
All right, everybody, take care.